Clogged arteries? This works in ways aspirin can't. And here's the part that'll surprise you. Aspirin may help with clotting, but it does almost nothing for the actual plaque in your arteries. This natural food, proven in human studies, doesn't just help, it can slow, and in some cases, slightly reverse that buildup. Let's start with the big picture. Aspirin works by reducing platelet stickiness. It makes it harder for blood clots to form, which helps prevent heart attacks caused by ruptured plaque. But here's what aspirin does not do. It doesn't reduce plaque buildup. It doesn't make arteries more flexible. It doesn't repair the endothelial lining. That's the real problem with cardiovascular disease. It's not just clots. It's the slow, silent damage happening to the inside of your arteries every single day. And that's why focusing only on clot prevention is like patching leaks in a dam, while the structure beneath is still crumbling. So what's the food? It's garlic. But not just as a seasoning. I'm talking about garlic as a clinically studied extract. And before you roll your eyes and think, garlic? Really? Let me explain. In several randomized controlled trials, the gold standard of medical research, aged garlic extract has been shown to slow and in some cases slightly reverse plaque buildup in arteries. Not just lower cholesterol, but actual changes seen on coronary artery scans. That's something aspirin has never been shown to do. Here's why this matters. Plaque in your arteries isn't like gunk in a pipe. It's more like a biological sore, inflamed, unstable, and prone to rupture. Aspirin makes it less likely a clot will form if rupture happens. Garlic makes rupture less likely in the first place by calming inflammation, reducing oxidative stress, and improving the stability of that plaque. That's a massive difference. Think of aspirin as putting a guard at the door, while garlic is repairing the walls from the inside. Let's talk about the science. Simply, garlic contains compounds like allicin and S-allylcysteine. These have three main effects on your arteries. Plaque stabilization, making unstable plaque more fibrous and less likely to break apart. Improved endothelial function, helping your arteries relax and maintain flexibility. Reduction of oxidative stress, preventing LDL cholesterol from oxidizing, which is one of the triggers for plaque formation. In one study using CT angiography, participants who took aged garlic extract daily for a year saw plaque progression slow dramatically, and some had measurable regression of soft plaque. And keep in mind, these weren't minor lab results. These were visible changes in artery structure on advanced imaging. And here's the part. Aspirin can't match. Aspirin works only on clotting. Garlic works on clotting and the underlying arterial health. That means lower inflammation, better vessel flexibility, and healthier plaque structure. In other words, aspirin is a band-aid for the symptom. Garlic supports the root cause. Now, before you think this means replacing aspirin melodivers, that's not the point. If your doctor prescribed aspirin, you never stop without medical guidance. The point is, garlic can be an adjunct, a natural, evidence-supported way to protect arteries that works in ways medications don't. But here's what most people don't realize. Garlic's benefits don't stop inside your arteries. In the next part, we're going to step right into the blood vessels themselves, so you can see exactly how garlic creates changes aspirin can't even touch. How garlic actually works inside your arteries. All right, we've set the stage. Garlic isn't just flavor, it's clinically studied for cardiovascular health. But the real question is why it works so well. Let's step inside your arteries for a moment. Your arteries aren't just tubes, they're living tissue, lined with a delicate, intelligent layer called the endothelium. This layer controls blood flow, regulates blood pressure, and helps keep plaque stable. When it's damaged from high blood sugar, oxidized LDL, or chronic inflammation, your arteries stiffen, plaque becomes unstable, and the risk of rupture skyrockets. Think of the endothelium like the Teflon lining of a nonstick pan. When it's smooth, blood glides easily. But scratch it, and things start sticking, fast. Here's where garlic comes in. Garlic's compounds, especially S-allylcysteine in aged garlic extract, directly improve endothelial function. They stimulate nitric oxide production, which helps arteries relax. This isn't just theory. Randomized controlled trials show measurable improvement in flow-mediated dilation, a key marker of endothelial health. That means less stiffness, better blood flow, and less pressure on those vulnerable plaque areas. In simple terms, garlic helps your arteries act younger than their age. Now about oxidative stress. This is the hidden engine behind plaque formation. Cholesterol itself isn't the villain. It's oxidized LDL that becomes a problem. Garlic reduces oxidized LDL levels. In a year-long randomized trial, aged garlic extract lowered oxidized LDL significantly compared to placebo. Think of it this way. Normal LDL is like a delivery truck. Oxidized LDL is like a delivery truck on fire. Garlic helps keep the fire out. That means fewer emergency situations for your arteries and more stability over time. And then there's inflammation. You've probably heard of C-reactive protein, CRP, a marker of inflammation. High CRP means your arteries are in an inflamed state, a dangerous place for cardiovascular health. Aspirin has some anti-inflammatory effect, but mostly on platelet activity. Garlic, on the other hand, reduces CRP, interleukin-6, and tumor necrosis factor alpha in human studies. Why does this matter? Because inflammation weakens the cap over plaque. A weak cap makes rupture and heart attack more likely. Garlic helps strengthen that cap. Think of it like patching a roof before the storm hits, instead of just cleaning up the flood afterward. Now, the clinical proof. One of the most important trials looked at patients with measurable coronary artery plaque. They were given aged garlic extract for 12 months. At the end, coronary CT angiography showed plaque progression slowed by up to 80% compared to placebo. Some participants even showed regression of soft plaque, an incredibly rare finding in cardiovascular medicine. And here's the key. These changes weren't just numbers on a lab test. They were visible on actual scans. That's like seeing the cracks in a wall not just stop spreading, but actually start to seal up. So how does this compare to aspirin? Aspirin reduces platelet aggregation, lowers clot risk. Garlic reduces platelet aggregation, lowers clot risk, improves endothelial function, lowers oxidized LDL, reduces inflammation, stabilizes plaque. See the difference? Aspirin is a single tool. Garlic is a multi-tool. It's the difference between having just a hammer versus having the whole toolbox. Now, I want to be clear. This doesn't mean garlic replaces medication. It means garlic adds another layer of protection, especially in prevention or alongside medical therapy. But there's one more angle here that makes garlic even more impressive. It's not just acting inside the arteries, it's working on the whole metabolic system, the root factors that drive arterial disease in the first place. Let's start with blood sugar. High blood sugar is one of the most damaging forces on your arteries. It glycosylates proteins, stiffens the endothelium, accelerates plaque growth. Think of it like pouring syrup over delicate lace. The fibers stiffen, lose flexibility, and break down. Multiple randomized trials show garlic can modestly lower fasting glucose and hemoglobin A1C. Not at drug level strength, but enough to reduce that constant sugar attack on your vessels. Better glucose control equals less endothelial damage over time. And over years, even small improvements can add up to massive protection. Next, lipid quality. Aspirin doesn't change cholesterol numbers. Garlic does. Aged garlic extract can reduce total cholesterol and LDL, but the bigger impact is on oxidized LDL and even on HDL function. Your HDL isn't just a number, it's like a cleanup crew. Garlic makes that crew more effective, improving reverse cholesterol transport. This means plaque gets cleaned out more efficiently before it causes trouble. And now, the gut connection. This one's fascinating. Your gut bacteria produce compounds that can either harm or help your arteries. An unhealthy gut microbiome increases inflammatory compounds like TMAO, which can worsen arterial disease. TMAO stands for trimethylamine N oxide. Garlic acts as a prebiotic, feeding beneficial bacteria like lactobacillus and bifidobacterium. These bacteria produce short-chain fatty acids, which calm inflammation and protect your endothelial lining. So, garlic isn't just working in your bloodstream, it's working in your gut, which then protects your arteries. In other words, it's like repairing the water pipes at the source instead of just patching leaks downstream. Here's the big picture. Garlic isn't a magic bullet, it's not instant. This is a long game strategy. The studies showing plaque stabilization or regression, they're 6 to 12 months long. With consistent daily intake, usually of aged garlic extract in doses used in trials. And here's something important. Most of the evidence comes from aged garlic extract, not raw garlic. Why? Because aged garlic is standardized for S-acetylcysteine, the compound most studied in humans. It's stable, predictable, and less likely to cause stomach irritation. That means you know what you're getting, and the dose matches what was tested in research. Why isn't this in every cardiology guideline? 2 reasons. First, most cardiology guidelines focus on drugs with huge multi-thousand patient trials. Garlic studies are smaller, but still high quality. Second, there's no pharmaceutical company funding large-scale garlic trials. Garlic isn't patentable. So while the science is strong, it takes longer for natural interventions to enter formal medical guidelines. It's not about lack of evidence. It's about how the medical system moves. Now, what's the takeaway for you? If you're on aspirin because your doctor recommended it, you keep taking it unless your doctor changes that. But if you're looking for a natural, evidence-supported way to protect your arteries, adding aged garlic extract could give you benefits aspirin can't. Better endothelial function, lower oxidized LDL, stabilized plaque, improved vascular health from multiple angles. It's like giving your arteries a maintenance plan, not just an emergency plan. And here's where we wrap it up. Your arteries are living tissue. They respond to what you put in your body, day after day. Thanks for watching. Take care of your health, and I'll see you in the next video.